Welcome to Wellspring on the Air. I'm Lindsey Steffen, a therapist at Wellspring and the host of today's show about caring for the caregiver. So we're talking about supporting those who care for a loved one with a neurocognitive disorder. So that's a big title. So
Yes.
we're going to unpack it. I'm here today with Dawn Plummer to discuss this interesting topic. Hi, Dawn.
Hi, Lindsay. How are you?
I'm good. Thank you. I'm glad you're here. Dawn's one of my favorites to record with. She always has a lot of interesting things to say. So we will be talking
Mhm.
about how, if you're a caregiver or someone you know as a caregiver, send this show to them so they know how to care for themselves. We're going to go into some stats and just different challenges they face being a caregiver. So, Dawn, why don't you tell us maybe a little bit about yourself before we dive in?
Okay, thank you. I too am a therapist at Wellspring Counseling. I'm a registered mental health counselor intern. I have training in EMDR, Gottman therapy. I'm currently working on a new training for the management of suicidal risk. A lot of exciting trainings coming up. And
Yes.
then I enjoy working with people who have depression, anxiety, really I'm a very wide uh, grouped therapist because I work
Yes.
with different ages, I work with different disciplines, people with substance abuse, trauma. Um, I really just enjoy being able to help pretty much anybody who walks in the door. That's
Right.
been my
She's
goal for a long time.
well-rounded.
Yes, thank
She's
you. So,
well-rounded, sees different, ages,
yeah,
issues. It's true. So,
yeah.
okay. Well, you have a lot of experience, obviously, and a lot to share with us today. And we've actually done some shows before with Dawn
Mhm.
on kind of, caregiving and later in life and developmental milestones. So she is one of her niches, one of the many. It's just kind of that later in life, that time period, and kind of what
Yeah.
to expect and how to make the most of it. And so we're always happy to talk with her on the radio and just hear from her.
Thank
So
you.
let's dive in because I know we have a lot to talk through. So I guess for someone who's a caregiver or maybe
Mhm.
about to become one, let's just start with what's some, I guess, some info, some things we should know that maybe we wouldn't just know naturally.
Okay. It's hard to say wouldn't know because there's a lot of information out there, a lot of information on the web. But as some people may or may not know, the pandemic actually has affected a lot of
Mhm.
older adults and a lot of people with neurocognitive disorders. We know that the nursing homes were greatly affected by the pandemic. And
Mm.
I believe it was the American Psychological Association who gave a statistic that said uh, many diseases can accelerate neurocognitive impairments. So we really are living in a time when this topic is extremely relevant. According to the Alzheimer's Association, about 6 million Americans are dealing with Alzheimer's, and about
Wow.
70% of people who have a neurocognitive impairment or a disorder like Alzheimer's actually live at home and
Mm.
usually like live with family. The majority of those people are living with family. So
Yeah.
there's a lot of caregivers out there. And sometimes you don't even know you're a caregiver
Mhm.
until you recognize, oh, wait, this person actually needs me to help them with some, daily acts of living, like things that we just do normally. They're
That's
having a
true.
struggle to
I
do it.
think I see that a lot with clients because actually here too, we're based out of the greater Miami area and it's kind of
Yeah.
normal culturally that grandma
Yes.
lives with you, maybe some aunts, a sister. And
Yeah.
so, but it's true, a lot of that, having maybe a grandparent or your mother, father in the home,
Hmm.
you do help them maybe get breakfast, you get their groceries, you're
Hmm.
doing little tasks for them that you don't even think about. Oh, I have this role, a formal role as a
Definitely.
caregiver, but it's pretty normal, I'd say, culturally here. And I'm sure in, other parts of the world, it's something
Yeah.
that it kind of goes without saying. You don't think
Yeah.
about it.
Yeah, actually, I believe Florida is one of the states that has a high population living in nursing homes.
Yeah.
So, I mean, people come to Florida to retire because of our weather, but then
Right.
they stay because of, just, this is a great place for older adults to kind of be and live and, walk out some of those final days. So, this
Right.
is a hugely important subject with regards to family and their older adults. You're absolutely right. Culturally, we got a lot of that where people are caring for family members, and it's just part of the culture.
Yeah.
But what comes with that is also some stressors.
Yeah, absolutely. Well, as you were talking, I figure you're using the term neurocognitive disorder. And I wonder, that's not everyone knows what that is, I'm sure, if
Yeah,
it's not in your, you're not in the field or whatever. So, what is that?
yeah.
What is a neurocognitive disorder?
Yeah, excellent question, Lindsay. When I was really thinking and preparing, I was like, this is not an easy answer to give. So I really
Okay.
struggled with like the shortest, easiest answer. So the shortest and easiest answer would be that neurocognitive disorders are problems with which affect certain parts of the brain. And
Okay.
these problems make it difficult to perform normal day-to-day activities. These problems or these impairments, as they persist, because there are some that are, let's say, they can be resolved depending on their origins, and then there's some that actually are diseases of the brain, and they are
Mm.
going to persist. The brain is going to deteriorate after a time, and then it's going to make it difficult, if not impossible, for that person to perform these activities without help. They
Okay.
will
So I
need
hear
help.
you saying some things are more treatable, but some are just going to run their course. Is that
It,
right?
right. You have really two categories of neurocognitive impairments.
Mm.
So, or neurocognitive disorders. One category is delirium. So, delirium is usually, they call it, the term is acute. So, it's usually something that has a rapid, it comes on unexpectedly. And it is usually caused by something that is often treatable. So, it could be, if you have medication, right, and you over medicated for some reason,
Mm.
like maybe you took a wrong amount of your dosage, that can cause delirium. And delirium actually, just like it can even present like like a major or a minor cognitive impairment, which is another
Mm.
term that we'll kind of go over in a minute. But it can present like that, which is maybe you're slurring your speech, or you are not able to focus, or these are different areas
Mm.
of the brain that get impacted. And but in reality, it needs to be adjusted. Your medications might need to be adjusted, or you need somebody to help you monitor them because you've
Okay.
taken the wrong dose. It could also be, say you are a diabetic and you have your diabetic medication and you forgot to take it.
Mm.
Sometimes you'll be experiencing some symptoms of delirium
Okay.
because you didn't take your meds. And
Right.
you
That
know
would be different. That's a side effect, yeah, of that
exactly.
versus just that kind of that
Yeah,
process of having a neurocognitive disorder, and maybe as
yeah,
things
yeah,
progress, you might have those symptoms that persist.
correct. And so
Okay.
with the other side of that is what we call minor and major cognitive impairment. Now that's
Okay.
another big word, but basically these are diseases of the brain.
Mm.
These are your Alzheimer, your Parkinson's, your if you had maybe a stroke and your veins had been constricted, and you lost oxygen to your brain, so now you have an impairment of the brain because of that. You have maybe trauma, like say
Mm.
you had traumatic brain injury. So these are impairments of the brain, diseases of the brain that are not going to improve.
Okay.
There's medication maybe to slow progress, but it's not going to get any better. So you do have to kind of understand and prepare for that. A lot of times it's difficult to accept it,
Yeah.
but it actually is not going to get any better.
Okay. Yeah. So I wonder what would be then, you've talked about some of it, but just in general, what would be some symptoms associated with a
Yes.
neurocognitive disorder?
Yeah. So some problems or symptoms are maybe in your attention. So activities that you used to be able to do very easily now seem to take a lot longer, like getting dressed, or maybe you are not able to focus, so say you're in your house, your television's on, maybe somebody's on the computer watching YouTube, so you got two kind of stimulus, and then there's a conversation, and it's really hard for you to be able to hear, to focus without kind of blocking something out or turning something off.
Okay.
You have maybe planning problems. You find it difficult to plan things or making decisions. Maybe you're starting to notice, so for caregivers, maybe you're starting to notice that your loved one is behaving socially different than what maybe they're acting out a lot more, saying things that are a little bit uh, off the beaten path, so to speak. And I think people kind of know what we're talking about. There's, maybe there's certain subjects that are just not really polite or in
Yeah.
conversations are typical. And maybe your loved one never used to, was always cognizant about how to read the room. And then all of a sudden they're starting to say and do things that are very out of context or out of ordinary.
Right.
Um, Learning and memory is often affected. You have
Mm.
difficult remembering things and learning new information. Language can be affected. Like sometimes the
Okay.
person's not able to recall certain words, or they're replacing words with other words that aren't applicable or do not apply. Um,
Okay.
and then you have like some of those motor skills that are starting to that really they're more like spatial, like hand-eye coordination kind of skills, like your driving skills are really starting to go down.
Mm.
There may be accidents are happening, like it could be like starting out basic accidents, but you want to keep an eye on those things, because
Okay.
those can often indicate a disorder.
Hmm.
Once again, that ability to read the room, those social skills are starting to decline, and those are some of a few issues
Okay.
with that.
Yeah, I feel like there's probably other things. We could go on and on just
Oh
talking
yeah,
about that, but for time's
definitely.
sake, well, we have just about a minute before we're going to take a break. So maybe I'll ask you quickly any other issues that might look like a neurocognitive disorder,
Mhm.
but maybe necessarily aren't.
Yeah. Well, okay. So this is interesting because you have delirium, which looks like a major or a minor cognitive disorder, but with, proper diagnosis and treatment, it can be resolved. But then you
Okay.
also have some mood and mental health issues that can look like a cognitive impairment.
Okay.
So, depression.
Hmm.
Depression, which is caused by maybe acute stress, depression and anxiety that might be caused by acute stress, often affects your ability to concentrate
Okay.
and attend. And so you may have noticed that your older adult or your loved one is having some really hard difficulties focusing. Maybe they're more forgetful, they're leaving the keys in the refrigerator, and you're
Hmm.
thinking, uh-oh, do they have a neurocognitive disorder? And
Right.
in reality, maybe if you're looking at kind of the whole of what's been going on in their world, maybe they had to relocate because,
Mm.
maybe a loved one passed away, their
Okay.
friend group is passing away, or they are financially insecure, and there's a lot of things there's a pandemic on, you
Yeah.
know there's a lot of things going on that are causing them the stress and anxiety, which is causing this depression, and it's
Okay.
affecting their memory. But
Yeah,
then if you're actually kind of getting that treated, that actually might improve some of these cognitions and abilities to think and focus. It might
that's
actually
true.
repair
Yeah.
some of that.
Well, I'm kind of hearing, yeah, if it was anxiety, depression, ADHD, if you treat those, that
Right.
concentration and focus will improve. So, okay.
Exactly. Yeah.
Well, very good, Dawn. We're going to take a short break for our
Well, that was
listeners, but
fast.
I know it always flies. There's never enough time, but
Right.
so tune back in. We'll be right back. I'm Lindsey Steffen with Wellspring on the Air. Welcome back to Wellspring on the Air. I'm Lindsey Steffen, and I'm here today with Dawn Plummer. We've been talking about caring for the caregiver. So, if you're someone who cares for a loved one with a neurocognitive disorder, and we defined in the first half of the show, that can be Alzheimer's, dementia, these different disorders. If you're someone who cares for them, you also need to care for yourself. And so we're
That's
going to go a little bit more into that with the second half of this show. But if you did miss the first half where we were defining what is a neurocognitive disorder, we talked about symptoms associated with that. You can go to your favorite podcast channel, Wellspring on the Air, or go to our blog page at wellspringmiami.org and just search for this topic. The title will be Care for the Caregiver, Support for Those Caring for a Loved One with a Neurocognitive Disorder. So, all right, Dawn, well, let's dive back in. And so we've been talking about those who maybe later in life or not even later in life do develop a neurocognitive disorder, but maybe you want to tell us a little bit just what normal aging looks like, so we know how to tell the difference. Is this an issue, or is this normal if we have maybe parents, grandparents living with us?
Yeah, definitely. And not just like parents and grandparents. There are some things that we might do and we're like, what's wrong with me? Do I have a neurocognitive disorder? I actually think that all the time. I'm like, and it's a really, really important issue to understand that aging does not automatically mean that you're going to develop a neurocognitive disorder. It doesn't, that you're going to develop these problems and fall into a decline. Normal, just like in normal aging, your skin might sag a little. You're going to get wrinkles. You're going to get gray hair underneath whatever dyes you're going to use.
Yes.
You're going to lose some body tone. You're going to actually maybe slow down a little bit. You're going to, you can't always keep up with the youngins. But you can still do it. I have a brother in the military. He's always actually beating out the youngins with their different military exercises that they do. I can't remember, he calls it physical training. And he's so proud of that because he's 2 years older than I am.
Okay.
So he's not that young anymore. But he's keeping up. And so that kind of shows you that aging doesn't automatically mean that you're going to fall into a decline. And in the same way, mentally, we will lose some things, but that's normal. So so now the term's escaping me, but basically there are memory losses associated with aging. There will be times when you forget your keys and forget where you put them, and that's okay. There'll be times when you are, you walked out of the house or you walked into a room and you don't remember what you came in for. That's normal. There might even be times when you're driving and you get somewhere and you're like, I don't know how I got here, and that's normal. So it's really important to recognize that not all memory loss is associated with a neural. There's going to be some memory issues that happen.
Okay. So kind of, it's good to know what should you expect or what could happen versus, should I maybe get assessment for actually something more serious going on?
Yes,
okay.
Definitely.
Well, let's dive in then. We wanted to talk about the challenges facing caregivers. So someone who's caring for a loved one with a neurocognitive disorder, what might be the unique challenges they face?
Yeah. So it's really, really important to recognize that a lot of times the caregivers, they're going to be affected by the challenges of the loved one who has the neurocognitive disorder. It's because a lot of the times those with neurocognitive disorders, they might act out in ways that are maybe sometimes embarrassing or maybe sometimes just really hurtful. And because they have a disorder, they're not going to remember that they did it.
Okay.
But the person who's caring for them does. So there's a little bit of emotional issues that are associated with caring for somebody, caring for somebody with a disorder. Like I said, there'll be like depression can come from that. Grief comes from that because the person who you are caring for, to watch them kind of go into the decline, they're going into the decline, they're experiencing it, but you're experiencing it with them because you're the one who has to watch that. There's anger because they don't remember what they did. You remember what they did, and now you're upset, and yet they're like, well, I don't understand why you're upset at me.
Yeah.
which also then comes with the accompanying feeling of guilt, because you know they have a problem, and yet you don't know what to do with these emotions. And
Wow,
so
it's all
really,
such a like a catch 22 because you're like, oh, it's not really their fault, but also I'm a human with feelings and limits. So kind of
yes.
balancing like how to honor both of those truths.
Yes, yeah, and really recognizing when you need to get help is very important. So, other challenges are physical. A lot of the
Okay.
times, people who are caring for caregivers often neglect themselves. They're
Mm,
neglecting their diet, they're not eating right. Because they don't have a lot of time. They have now another schedule to contend with. They're taking their loved one to the doctors. They're making sure they get to different places. They're arranging health and health care for them. They're keeping on top of their medication, which means that, you can't always do everything. Nobody can do 100% in every area, right?
right.
So you have these, so eventually they're going to neglect themselves. They're
Mm,
not going to eat right. They're not going to exercise. They're not getting their quiet time. They're not praying. They're not reading their Bible. They're not going to church anymore, which dives into the social aspect of the challenges. They're
okay.
oftentimes getting isolated. They're
Mm,
oftentimes, because what'll happen is they have their loved one at home. Their loved one maybe acts out in certain ways, which they don't want to expose their loved one to other people's comments or review.
right.
They don't, and also it could be a little bit embarrassing. So they're really leery about inviting people into their home. And
Okay.
then in order to go out, they're going to need like a caregiver or somebody to watch their loved one. And oftentimes they don't have one. And it
Right.
depends on what their support system looks like. So they're
Okay.
stuck. They can't go out. They can't come. They can't invite people in. And so there they are with their loved one who's declining, and they're very much alone.
Yeah.
Um,
And that's not someone maybe who can necessarily, it depends on the level, but maybe they can't converse and kind of enjoy that give and take of relationship if they're more
yeah,
just the one pouring in. So, yeah, it sounds
right.
like it can be very lonely.
Yes, there's
Okay.
financial issues because if you decide to have a loved one stay with you, you may have to renovate. You may have to add bars to your bathroom. You may have
Wow.
to, invest in ramps. There's a lot of like monetary investment that can happen. There are programs that can help, and we'll get into that a little bit later.
Okay.
But there can be a big cost. There's medical costs that are involved, and
Yeah.
then and here's that part of that catch 22, if you are not attending to yourself, you're going to have some medical costs for yourself,
That's true. So let's
you know?
actually go into that, why caring for yourself is so important. Some of this is kind of
Yeah.
obvious, but let's
Yeah.
expound on that a little bit.
Yeah, definitely. And this is a huge issue too, because actually, some studies have shown
Mhm.
that if a person's environment, if a person with a neurocognitive disorder, their environment is peaceful, is calm, is loving, they actually do better.
Okay.
Deterioration can be, I'm not going to say slowed or arrested, but it's affected in a more positive way. And
Interesting.
so the caregiver's health and well-being directly impacts the one they're caring for.
Wow, that's so interesting, but it makes sense, when we think of it. But yeah, it's kind of if you're a parent who's stressed, then your kid is going to have some anxiety going on. So
Yeah,
kind of it's almost a parallel role in some ways. So,
yeah. As a
okay.
therapist, we both know environment is hugely important to health and
Yes.
well-being. So that is really big. We
Okay.
must, this is the motivation for the caregiver to stop and really assess their own self-care.
Yeah, and really, yeah, make sure they're not burning out and be doing the things way before we get to that point. So,
Right.
what might be some of those tasks that a
Mhm.
caregiver could do to care for
Yeah.
themselves?
Yes, and I'm really excited about this because when I was preparing, I said, "I have 3 Ps."
Oh,
3
perfect.
Ps. I
Easy
have,
to
3.
remember.
Yes. So the first thing that a caregiver wants to do is to ponder.
Okay.
They want to think about, now um, the interesting part of neurocognitive disorders is oftentimes they are very slow. From the time that you recognize that something is wrong and you get it assessed and diagnosed by a doctor, by a psychologist, um, you actually have some time.
Mm.
It's not usually, that's why like the difference between delirium and a cognitive impairment is important to know, because deliriums usually happen pretty fast. Cognitive impairments are a slow decline over time. So you
Okay.
actually have time to sit and go, okay, can I do this? Do I want to do this? You
Okay.
know, and
Yeah.
really take that obligation aspect out of the create the equation. And you
Right.
want to do that. And I'll tell you about that. That's part of the third P
Okay.
of your tasks for the self-care, for the caregiver, is because you need to think about, do I have it in me? What do I need as far as free time,
Okay.
to stay healthy?
Right.
How can I do this? Really introspection. You're really looking at yourself and
Yeah.
going, because what you do directly impacts the person that you are caring for.
Right.
So
So do
that's
you have the
P.
capacity? Okay.
Exactly. So you're
Yeah.
pondering that. So
Okay.
number two is planning. Because it's a slow decline, there's a lot of information out there, and there's a lot of agencies to help, but it takes time for these agencies. There's forms and applications that are going to need to be submitted. There's people involved. Usually, if you are not, say you have siblings, they're going to want some say. So there's going to
Yeah.
be this kind of planning for
Okay.
this event. And the more that you can get informed, the more that you can plan, the better. And
Okay.
the better prepared you're going to be to take on this huge responsibility.
Okay. So
And
we have
that
ponder, plan, and
and then the third one is preparation. Or
preparation.
yeah, so
Okay.
you're preparing your heart, which is an
Oh,
interesting, I bet you didn't think I was going to say that.
no, I
Yeah.
didn't.
Um, there is a can I reference a book
Of
that
course.
I really love, which is
Mm.
called I believe, do I have a moment to look it up? I
Mhm.
should have had it written down. Actually, I think I do. Give me one
Okay.
second. Okay.
Okay.
So there is a book called Finding Grace in the Face of Dementia by John
Okay.
A. Dunlop. And he actually talks about kind of how caregivers have an opportunity to really show the face of God in the care that they
Mm.
provide for their loved ones with dementia, Alzheimer's, neurocognitive impairments.
Wow.
Because it's not usually the situation that causes the problem. As therapists, we know this. It's usually our thoughts and feelings about the
Mm.
situation. And
Right.
so if you're a caregiver, or you're going to be a caregiver in the future, you know that God has actually given you a chance to serve. And
Wow.
so, God calls us to be servants. And so this is a huge opportunity to serve. You will be
Right.
serving in a capacity that there might be some hygiene things, helping people get dressed, things that you never expected to do.
Mm.
You might end up doing, and as you prepare to love the person you're caring for, you're really exercising God's love to them. God says, what you do to the least of these, you have done for me.
You're really the
So
hands and feet doing
exactly,
the hands-on
exactly.
care. I love that. Your three P's. So we had ponder, prep,
Plan.
plan, and preparation. So,
Yeah, yeah,
well, Dawn, we're gonna have to close with that. We could keep talking forever, but our time always flies. So, but thank you so
yeah.
much for teaching us about this today, and just thank you for being here today.
My pleasure, my
Yeah.
pleasure.
And thank you for joining our show. To all our listeners, if you join the program midstream, you can find this show and others on the podcast channel, Wellspring on the Air, or go to our blog on wellspringmiami.org. The title of today's show again was Care for the Caregiver, Support for Those Caring for a Loved One with a Neurocognitive Disorder. And encourage us, reach out and let us know any comments or questions you have. You can email us at ontheair@wellspringmiami.org. So it's time to wrap up. This is Lindsey Steffen with Wellspring on the Air, because hearts and minds matter.